ये हो गया राइट। क्लास ले रहा हूँ मानूंगा। Okay, let's begin now. Hey guys, first of all, sorry for the delay. The delay was due to some internet connection issues. Initially, I did not have the some acting up adequately. So first of all, I really apologize. 5 minutes, right? So don't worry. We'll begin the class with enthusiasm. We're going to, but a little might have been abuses, but I guess. So welcome to Let's Crack NEET PG, the YouTube channel of Unacademy, India's largest on. Again, guys, I apologize for the internet connectivity. I think it's fine from now. So right now we are doing lower limb MCQ marathon. So I was trying to cover lower limb as a separate session also, but the problem with doing that is that the lower limb is a pretty topic. So it would be pretty much repetitive and it's pretty easy if you do it on your own. So, but I wanted to give you all the important concepts via these multiple choice questions. So like for upper limb, I had taken a class on arteries separately. I had taken a class for nerves separately. That's pretty much not required here because here it's much easier to study everything, the sense of the compartments of the eye, compartments of the leg. Although, to help you all, what I will be doing today is I will be telling you a little bit about the soul. So I will be telling you about the muscles of the layers, about the muscle layers of the soul, and I will be simplifying it for you. And that is the most difficult part here in the load, and that I'll explain to you. Right after the introduction. वो देख लेना जरूर बाकी तो so welcome to Let's Crack NEET PG, the YouTube channel of Unacademy's NEET PG division, where you have the top educators, quality content, and a great learning. Hence, that is assured to you. So first of all, if you're wondering about me, my name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is in New Delhi, in West Medical College. All India rank 4 in the UG AIMS examination and All India rank 5 in the per UG examination, right? And now all the examinations merged into a single examination called as the NEET examination, whose result was declared recently. And as you all know that for the PG entrance, there is going to be a single examination called the next. Is said to be based on the clinical pattern, and only 10% weightage will be there for pre and paraclinical, right? Only weightage. So therefore, whatever anatomy we study from the PG entrance perspective, it should basically be clinical anatomy, right? It should essentially be clinical anatomy. So that is why we are doing MCQ Marathon Lower Limb Part 2, that we will do MCQs, we'll see their clinical perspective, and that is how we are going to cover. lower limb. So first of all, I would say one thing: just go ahead and download the Unacademy Learning app. It is zero loss and 100% profit deal. Why? Because it is a free app. You just install it, right? Uh, and then once you do that, you will see that there are a lot of top educators here who are teaching for NEET PG. So you can see all of them have decent watch minutes, a decent number of followers. So they're well respected faculty, their respective fields, and these educators, the educators here, we make plus courses, right? So I am also going to make a plus course for November, right? And all of these courses are locked, which means that you can only access these courses if you have a plus subscription, right? But why am I telling you to download the app even if you don't want to take a plus subscription? Is because I have these free special classes there, and these free special classes, they are absolutely free of cost. For every subject, some teacher will make some specific discussion which is very pointed, which is very targeted, and which might be very useful. For example, if you want to know about the development of heart in embryology, you can just go ahead and watch this. Similarly, I had made a special class for arteries of upper, right? I had made a special class for basal ganglia. So if you want a quick look over these topics, you can just go ahead and watch these special class, right? So, and besides that, you have the option to attempt free mock test there. And if you are a plus user, that's even better for you because you will never fall short of questions. You have weekly mock tests here, okay, which is a very good frequency. It will give you comprehensive syllabus coverage. Okay. Now, why is Unacademy the easiest way to learn for NEET PG online? The reason is that since we are MBBS students, we are busy, have whereas Unacademy gives you the option to have a very flexible schedule, right? You can learn according to your own convenience. There is a class at whatever time you want. You can learn whatever language you want. ठीक है, English में भी बोल सकता हूँ मैं, हिंदी में भी बोल सकता हूँ. Then there are teachers who are teaching your southern languages as well, Malayalam, and unlimited practice. है, you can reattempt all the tests again, and you can also rewatch all the videos again. That is another benefit. ठीक है, तो सारी वीडियोस 1.75x पर देखो, जल्दी जल्दी सिलेबस भी कवर होगा, बार बार भी देख पाओगे, ठीक है, सब समझ भी आएगा, मस्त रहेगा. And since this is YouTube, I have opened the chat of the YouTube live here on my phone so that you can chat with me directly, you can ask your questions, you can get your answers, right? So plus you will also have interactive polls here. So similar, today's MCQ session will be completely interactive. I will be asking you each and every question, right? And you can have the ability to learn anytime and anywhere. घर पे बैठे हो, मेट्रो में बैठे हो, ट्रेन में बैठे हो, जहाँ बैठे हो, ठीक है? Just before I begin, wait, I'll tell you about the subscription. Before that, let's start a little bit from the topic, and then I'll come back and I'll tell you about the subscription, right? The first thing here, these are the four muscle layers. These are the four muscle layers, right? Now, why am I saying that these are the four muscle layers? Okay, so देखो, muscle layer number one, muscle layer number two, muscle layer number three, muscle layer number, right? These are the four layers that are present inside the soul. So what I am saying is that inside the soul, all the intrinsic muscles, they are organized into four layers. All right. Yeah, what do I mean by intrinsic muscles which are present inside itself? All the brevis. Okay. उसके अलावा there will be the longest muscles also. Okay, वो first और third layer में होती है, but that is not relevant right now. We are talking about the intrinsic muscles only. Let's talk about the not talking about their longest counterpart because they are part of the leg, right? They start from the leg, so that is where you start. So if this is your soul, so you will have four layers, all right? So they will be organized into layers inside your foot. Okay, one, two, the ऊपर deeper जाते जाओ, right? So that is first thing that you should know, that they are organized into four. Now, besides the fact that they are organized into four layers, you have to know what are the muscles in each layer. What are the muscles in? Now, to write that, there is this trick will help you a little bit. So let's do it. Let's do it. Very important trick. All right. ठीक है. इसके बिना ये muscles को memorize करना बड़ा मुश्किल है. Right? I am seriously telling you. That is why I am doing this even before I tell you about the Unacademy Plus and Iconic. तो डू वन थिंग, यहाँ पे क्या होता है तुम्हारा, ये होता है तुम्हारा ग्रेट टो, उसके बाद ये होती है सेकंड थर्ड फोर्थ, और ये फिर राइट। छोटी फिंगर को हम अलग अटेंशन देते हैं और ग्रेट टो को अलग अटेंशन, बिकॉज इसका होता है डिजिटाई मिनिमाई, इसका होता है डिजिटाई मिनिमाई। फॉर द थंब यू हैव पॉलिसिस, फॉर द थंब यू हैव पॉलिसिस, फॉर द ग्रेट टो यू हैव एलुसिस, द ग्रेट टो यू हैव एलुसिस। ऑलराइट, तो यहाँ लिखो ग्रेट टो के बारे में, यहाँ लिखो लिटिल फिंगर। ऑलराइट, so let's first write about the first and the third layers, and then we'll talk about the second. And so in the first layer you will write on the great toe side, write the abductor hallucis brevis, right? You've written abductor hallucis brevis. Hallucis is for the great toe. Similarly, for the little finger you will have abductor digiti minimi. Much is done. Most outwards, right? ठीक है, great toe और little finger का लिख दिया. अब what you will do is, in between them you will write flexor digitorum brevis. इसके बीच में क्या है, digits, right? You have digits. You will write flexor digitorum brevis. यहाँ क्या लिखे, abductors, बीच में क्या लिखा, flexors. थर्ड लेयर में उल्टा कर दिया, ये flexors को तुम बाहर ले गए. Take this here and take this here. What you write here is flexor hallucis brevis. Hallucis why? Because great toe is hallucis. Here what do you write? Flexor digiti minimi, and in between what you will bring, abductor हो चुका, ठीक है, abductor हो चुका. Now you will write adductor. Now you will write adductor hallucis. Right, adductor. Yeah, that is the basic guideline for writing the first and the third layer. Now in the second and the fourth layer is very simple. You have to only write here one word. Fourth layer is very simple. Only one word you have to write there. What is that one word that you have to write? Veroshai. The one word that you have to write is Veroshai. Right? That is the single word that you have to. Then here you have to write the lumbricals. What are the lumbricals? First lumbrical, put a comma. Second, third, fourth lumbrical. Besides that you write flexor digitorum accessorium. ठीक है, ये याद रखना है. सेकंड लेयर में lumbricals लिखने हैं 4 एंड flexor digitorum accessorium, ये बस याद रखना है कि ये लिखना है. राइट, आफ्टर यू आर डन विद दिस इट इज वेरी सिंपल. देयर नर्व सप्लाई भी इसी में हो जाएंगी. ये नर्व सप्लाई भी इसी में हो जाएंगी. ये तो 4 लेयर्स कौन सी है वो लिख दिया. अब उसके बाद नर्व सप्लाई के लिए क्या करना है, हमने बनाने हैं बॉक्स. बॉक्स कैसे बनाओगे, देखो, ये फर्स्ट सेकंड थर्ड लेयर के ये मसल्स जो हैं ऐसे करना है. ये बॉक्स बनाना है जिसके अंदर 4 मसल्स आने चाहिए. ठीक है, वन बॉक्स एंड देन दिस इज द, these will be supplied by the medial plantar nerve, will be supplied by the medial plantar nerve. The branches of the tibial nerve. The tibial nerve divides, it forms the medial and the lateral plantar nerve, right? The medial plantar nerve, this is the lateral plantar nerve. They are supplied by medial plantar nerve. So medial plantar nerve supplies how many muscles? 1, 2, 4. Lateral plantar nerve supplies how many muscles? 1, 2, 3, 4, 5, 6, 7, 8. 8 क्या इंट्रोशिया कितने होते हैं? For introssia, the multiple introssia, but these are the 8 that you have to remember here that are being supplied here by the lateral plantar. 4:8 का रेशियो याद रख लेना, उससे मेरे को थोड़ा सा हेल्प होती है ये बॉक्स में. इसके अलावा medial plantar nerve supplies 3.5 fingers of the skin and lateral plantar nerve supplies 1.5 finger. Okay, so basically I had just shown you how to write this entire thing, how to memorize this entire thing. Alright, you should keep that in your head when you are doing it. But otherwise this much is sufficient. But it is very important to know the process with which you are writing it. Okay, what is important is कि ये कैसे लिखना है. पहले क्या लिखा, पहले यहाँ पे hallucis brevis और abductor digiti minimi लिख दिया, बीच में लिखा flexor, फिर ये 2 flexor ले गए बाहर फर्स्ट और थर्ड लेयर में, क्या लिख दिया अब adductor. ठीक है, पहले क्या थे abductor, यहाँ लिख दिया adductor. नीचे क्या आना है, एक वर्ड इंट्रोशिया है, यहाँ पे क्या आना है, lumbricals and flexor digitorum accessorium. Then what comes here, medial plantar nerve and lateral plantar nerve. Here you write the, right, so that is about the muscles, intrinsic muscles of the 4 layers of the soul. All right, this will help you to get a basic idea. इससे आपका soul वाला जो muscles वाला part है वो क्लियर काफी क्लियर हो जाएगा, राइट? नाउ लेट मी गो बैक टू द प्लस एंड द आइकॉनिक सब्सक्रिप्शन. Let me tell you a little bit about the Unacademy Plus and Unacademy, right? Unacademy Plus is your access to the best of Unacademy. What is there in Unacademy? Get live classes, get live tests, live quizzes. Okay, plus you have batch courses. Okay, यहाँ पे दिखाया था मैंने. Okay, so these are batch courses where 4 educators are teaching a subject together, or they are teaching interconnected topics together, right? So those are batch courses. Get these batch courses and you also get a structured schedule, right? What about Unacademy Iconic? And Unacademy Iconic, the better deal. Unacademy Iconic is the better of the two options. Why? Here you get the best of both worlds. Unacademy is already India's largest online learning platform. Unacademy is already India's largest online learning platform, right? Here you get Unacademy plus you also get Prep Ladder. And इधर Prep Ladder में क्या मिल रहा है? Get video lectures of Prep Ladder, all video lectures which includes PRG sir's pharmacology and Apurv Mehra sir's ortho, right? Which is very famous for building the basic concepts of these topics. Besides that, you get question bank, the latest question bank with rapid revision course and handwritten. Okay, that is why go ahead, select Iconic, and this is the pricing structure for Iconic. For 1 year, Iconic Iconic costs 55,000, right? It costs 5,000, and for 2 years it costs 77,000. Years it is 92,000. Once you apply this referral code, once you apply my referral code, that is Chetanya 10, right? This will be for 49,500, or 49,500, right? And for 2 years it becomes 69,300, and this becomes 82,800. So here you are getting a rupees 9,200 discount just with my referral code. Just with my referral code. Besides that, if you are able to use credits, you will get an additional discount. And if you are using my referral code, I will give you a cashback from my end. So this is going to be the best deal that you will get. That is why this is the only referral code that you should. Even if you are taking, if your brother or sister is taking a subscription, let's say for UPSC or for IIT or for any examination on Unacademy, use this referral code and I will extend the same offer to them also, right? Just contact me. How you can contact me? On Instagram, you can contact me at the rate chetanya.2. You can also contact me on Telegram through my Telegram channel, that is at the rate NEET PG Chetanya. Okay, इसका discussion group है. You can just find me from there and you can directly text me. Okay, for an Unacademy Plus, right? I will definitely. Okay. So that is about this. And then if you don't want to take Prep Ladder, then also you can take Unacademy Plus. And these are all the various courses that are there for Unacademy Plus. Here you can see the 3-year subscription plan is nearly for 50,000. And you can even take a shorter course if you want to just try it out. I will recommend you take the 3-month course if you want to give it a trial, right? And again, here with my referral code, get the same benefits, 10% discount plus credits, you get more discount, plus if you get a cashback from my net value. Yeah, so that is about the Unacademy Plus subscription. Yeah, let me let's start with question number 51. That is the first question. In children, the head of the femur is supplied by all of the following arteries. So which artery does not supply the head in children? ये तुम बाद में सोचोगे ये कैसा सवाल हुआ, but I'll tell you, this is not a question of the lower limb, not a question of the. तुम्हें लगेगा कि ये कैसा बेहुदा सा सवाल. Guys, what is your answer? Guys have an answer? The obturator artery is wrong, Priya Sharma. I'll tell you why. Have a look at this question. I'll just go ahead and now look here. B, C, D. These they supply the femur children. In fact, artery of the ligamentum teres is the major supply, or one of the major supply. Okay, but you're not expected to know this. You're not expected to know this that children में specifically अलग से femur की क्या supply होती है, right? Vinita Sri, the answer is not C. C is in fact, like I just said, it is the major blood vessel. It is the major artery supplying the head of the femur. The answer is option A, nutrient artery. Okay. Now, why is this A? This is not a question of the lower limb. It's a question of general anatomy. Question of general. Have you read the blood supply of a developing bone? You read the blood supply of a developing bone in general anatomy. What happens? Okay. So the bone, how it starts to develop. How it starts to develop. There is a primary ossification center, and the nutrient artery goes inward, right? Then there is a calcified matrix here, right? Where you do not have a communication, right? This remains the epiphyseal plate. This is the metaphysis, right? Remember, this is the epiphyseal plate. Metaphysis or epiphyseal plate. So the nutrient artery, it does not supply this epiphyseal region in a long bone in children, right? Till the time there is closure of epiphyseal plate, it does not supply it. Yeah, till the time there is closure of epiphyseal plate, it does not supply it. After closure, an anastomosis develops here. Yeah, then the nutrient artery will supply. But in children, there is a separate blood supply for the head because there is a secondary ossification center there. The nutrient artery will provide nutrient to the shaft. It will provide nutrient to the shaft or the diaphysis, right? So the head of the femur is a long bone. In children, the long bone is developing, right? So then the epiphyseal plate has not closed. The epiphyseal plate has not closed. There is cartilage in between, and cartilage is avascular. Cartilage is avascular. So there is no communication here between these vessels. So the nutrient artery supplies only the diaphysis or the shaft of the femur, but it obviously is not able to supply the head of the femur. So I hope you like the explanation for this question. It's a very simple question, not a question of the lower limb, but a question of general anatomy and basic general thinking about how does a bone develop. Right? That is how you have to attempt this. I hope this is clear to you all. Have any doubt, please let me know. Let's move to question number 52. Abnormal obturator artery is the branch of. Abnormal obturator artery. Yeah, I hope you like the explanation of the previous question. The fact that it is a question given in the lower limb, but it is actually a question of the general anatomy. You can basically solve it based on the blood supply of a developed head. Question number 52, guys. What is your answer going? Those who haven't watched the initial 15 minutes of the video, it's okay. But the video after 15 minutes, around 15 minutes, where I have told you about the layers of the muscles of the layers of the, do watch it. ये बहुत अच्छे से समझाया है, and there's a trick for that. The video, do watch it. The muscles of the layers of the soul. Um, उसमें I have also explained the nerve supply. Because I remember that yesterday there was a question that which of the following is supplied by the medial plantar nerve. So that question can be easily answered based on that explanation, right? So Shraddha Sharma has answered that abnormal obturator artery is a branch of internal iliac. Does anybody else agree with the answer? Normal obturator artery. Obturator artery, obturator artery normally, right? Obturator artery is normally a branch of the internal. That's true, normal. But the abnormal obturator artery is an accessory artery, right? It is not the normal obturator. It is not a branch of the internal. Iliac. The answer is something else, right? Right in thinking that the answer is internal iliac, but that is the case for the normal obturator. This question specifically says abnormal obturator. Yes, Sharma is saying C. Abnormal obturator artery arises from the obturator. Again, this is the correct answer. The correct answer give you is option D, inferior epigastric artery. Right? Abnormal obturator artery, it is something that you have to be very careful of because it passes very close here to the lacunar ligament, and it can get in some kind of an operation where you are not aware about this anatomical variant, might miss it, and that can lead to heavy from the abnormal obturator artery. Why? Because it is a branch from the inferior epigastric. Right? It is a branch from the inferior epigastric. The femoral artery, inferior epigastric artery, that sometimes gives this abnormal obturator. Right? Remember that has a clinical significance. That is why it can be a good question in case of your next examination. That there has been some heavy bleeding due to an anatomical obturator, the abnormal obturator, which is the source of the abnormal obturator. It passes very close to the lacunar ligament. So let's say for this hernia, if you take a surgical approach, might get injured. Okay. Question number 50. Muscles originating from the ischial tuberosity are all except are all so which are the muscles which originate from the ischial tuberosity? First thing that what are the muscles from the ischial tuberosity? Now why that is important is because these muscles are the four criteria for hamstrings that I told you yesterday. One of the criteria was have the common origin. So very easy to think which of these are hamstrings take origin from. Semimembranosus, semitendinosus. They are definitely are. Adductor magnus, it is technically it is not a hamstring, but still it is counted there because it also takes its origin from the ischial tuberosity. What is left? So what is left? Not going to be a hamstring. It is going to be the short head of the biceps. Right? Obviously, here it is not talking about the short head of the biceps of the arm. Here it is talking about biceps femoris. Right? Short head of biceps. Have a look. Hemimembranosus. semitendinosus, long head of biceps. All of these, they are taking origin here from the, not seem to be taking origin. It is taking origin. Actually, it takes origin from the tinea aspera. From the tinea aspera. I hope you have again. Tinea aspera, it gives origin to the short the bicep. Here, question number 53. Yeah, absolutely. Here, the long head of the biceps femoris does take origin from the ischial tuberosity, but the short head takes origin from aspera, and biceps femoris, otherwise long head, is part of the hamstrings. Semimembranosus and semitendinosus, they are perfect hamstrings. They will definitely take origin, right? Adductor magnus also takes origin from the ischial tuberosity, but it attaches to the femur itself. Although it does have the tibial collateral ligament, which is the divorced tendon of the adductor magnus, which is why it is sometimes counted as a, ठीक है, ये कल पढ़ाया था मैंने, इसे डिटेल में पढ़ाया था ये. Question number 54. Which of the following is true about the lateral meniscus? Number 54, true about the lateral meniscus. बताओ आंसर. So remember, you have to tell the true statement. Nikola Tesla has said that the answer is, टेस्ला सर तो बहुत इंटेलिजेंट थे. आंसर है, he is wrong. It's very easy. You have just three options left. Okay. निकोला टेस्ला ने तुम्हारा काम आसान बना दिया. अब तीन में से गेस करना है. So just take one more guess. Nikola Tesla, why don't you take another? We now come to the guessing. Tell you to apply for a question that you don't know the answer, especially one that's statement based. Right. Adrenergic. A is also wrong. Chalo, I'll correct explanation. It is nearly semi-lunar. No, it is nearly. Now, which one is semi-lunar? The medial meniscus, nearly semi-lunar. Yeah, that's the first point. Medial meniscus nearly semi-lunar. The lateral meniscus is more liable to injury. No, the medial meniscus. So now you know 2 points of differences between the medial and the lateral meniscus. What are those? The lateral meniscus is circular. The medial meniscus semi-lunar. So remember this. I like to remember this way. The lateral meniscus is lunar. The moon is round, right? The moon is circular. So L for lateral, L for lunar. L is semi-lunar, and it is more liable. M for M, more liable to. L for L, or less liable to. More and उसके बाद I have already told you that D is incorrect. What is left? Posterior surface is hit by the popliteus, right? Popliteus muscle, it is present on the lateral side, clearly, and it's present on the lateral side posterior. What is the orientation of this diagram? Just have a look. Here, this is here, and this is right. So here you can see, you can make out the medial meniscus, right? Medial meniscus is lateral meniscus is circular. Medial meniscus is more curved, right? Semilunar, eccentric, right? Kind of crescent. And here, one more thing that is there is that have a look on some other structure. Other structures that I want you to appreciate here are, first, I want you to see the cruciate. Second, I want you to appreciate the anterior cruciate. The two things that first really you have here, anterior cruciate. Then now the question that was talking about, it was the popliteus muscle. It indents the posterior surface of the lateral meniscus, right? The anterior, this was posterior. Yes, it indents the posterior surface of the lateral meniscus. Fibular collateral ligament is separated from it by a bursa, not attached. Fibular collateral ligament not attached to the meniscus, separated from it with the help of a bursa. Separated from it with the help. Now look at here. Here, there is another point of difference here, that the tibial collateral ligament is connected to the medial meniscus. Another point of difference here is tibial collateral ligament connected. Whereas if you look on the lateral side, the lateral or the fibular collateral ligament is separated by a bursa. That is another point of difference here between tibial and the lateral ligament, right? Right. Tibial collateral ligament connected to the medial. Right? Question number 55. Next question is question number 55. Trendelenburg sign is positive with weakness or paralysis. Okay, so I'm explaining the questions in a great detail right now because I want to cover all the concepts that are. Question number 55. Trendelenburg sign is positive with weakness or. I want you to tell me two. Right, I want you to tell me two. First, tell me what are the muscles that are paralyzed in the Trendelenburg signs. What is the nerve that can be in the muscle? The option only has muscles. Right? Also, tell me the nerve that is. Right. So it is the muscles are the gluteus medius and minimus. The nerve is the superior gluteal, right? The gluteus medius, gluteus minimus. Nerve is the superior gluteal nerve. So why this is the superior gluteal nerve here? Superior gluteal nerve, it supplies three. Supplies the gluteus medius, gluteus minimus, and is the tensor fascial artery. Remember, it does not supply the gluteus maximus. Please remember the superior gluteal nerve does not supply the gluteus maximus. So Trendelenburg sign is positive. Injuries to the nerve, or if there is weakness or paralysis. Yeah. Question number 56. What is the largest branch of the lumbar? Nikola Tesla's sciatic nerve is wrong because first of all you should know that the sciatic nerve, it is not a branch of, it is not a branch of the sciatic nerve is a very large branch, alright. It's one of the largest nerves of the body, but sciatic nerve, it is not a branch of the lumbar, branch of the sacral plexus. Okay, so that is the first thing. That is why the answer is not going to be sciatic nerve. The answer here, right, is given by Priya Sharma. The answer is 6, 7. Let's go with right. So Priya Sharma has given the answer for oral nerve. Now, question number 57. Can I get a fast answer? About the boundaries of the femoral canal. Acular ligament, right. 57. The answer is option B, acular ligament. Here I have kept a diagram to show these boundaries their exact way. This is the femoral canal, the one shown in yellow, femoral canal. Look here, the anterior border is formed by the inguinal ligament. Really, you will have the muscle forming the floor of the femoral canal, the femoral triangle. Floor in the floor of the femoral triangle, here you have the pectineum. Right? The lateral border here is formed by the femoral vein, and on the medial border, you have the acular. Medial border is formed by the acular ligament. The anterior border is formed by a ligament. The write down anterior ligament border. Have a very clear picture of what are the boundaries. of the femoral canal. इसके ऊपर को femoral ring भी कहते हैं, right? Topmost part of the femoral canal is known as femoral. Question number 58. A 10-year-old boy, a venesection of the great saphenous developed sudden pain and paresthesia on the medial aspect of the after incision of the venous ligation. Right. So here the answer is option B, saphenous nerve. Why? Because the saphenous nerve, it accompanies the great saphenous. Great saphenous. It's a very frequently asked MCQ at which nerve accompanies the great saphenous vein. The clinical form of that MCQ. That while during the venesection of the great saphenous vein, this is a very common injury. You have to be very careful of the saphenous nerve because it goes very closely with the great saphenous. Okay. So, and you should know that the medial aspect of the great toe is supplied by the saphenous nerve. Later on, I will show you a diagram where I will show you the entire uh, nerve supply of the foot, the dorsum, and even the ventral part. There you will see that the saphenous nerve does supply the medial aspect of the. Okay, that is another hint here. There are two hints here. First, that it accompanies the great saphenous vein. Second, that it supplies the medial aspect. Okay. Question number 59. The lymphatic drainage from the lateral part of the foot is. Very easy answer. All right, you don't have to think much. जल्दी बताओ यार आंसर एक का तो मारो. There are just four options. One. Okay. Karan Seni has given the correct answer. That option 4, popliteal lymph. So basically what happens is that all the lymph from here, from the foot, the lateral part of the foot, the heel, you can see that the lymph, it goes through the popliteal lymph nodes, right? Goes through the popliteal lymph nodes first, and then it goes through the superficial inguinal lymph nodes. Okay. Some of the lymph also goes to the deep inguinal lymph nodes, but that is the medial side. Mainly the lymph from the leg goes to the superficial inguinal, right? Goes via, right? Question number 60. Following is an expansion of the semimembranous tendon. Membrane. Okay, Nicola, no, no, no. It's not A or B, it's D. It's popliteal lymph. After that, the popliteal lymph nodes obviously they drain to the. So Dr. House, right. So Dr. House has cannot given wrong answer. So it's right. Oblique popliteal ligament is the answer. So I hope you have watched the TV House MD. If you haven't, it's great TV and better than Grey's Anatomy. At the book. So right. So the following is an expansion of the semimembranous tendon. The answer is oblique popliteal. I al- I've already told you that often this question is asked as oblique popliteal ligament comes from. Options have semimembranosus and semitendinosus. So I usually used to get confused. So how I think of this is that ये तो ligament है, right? Ligament is very different from a tendon. This is half muscle, half tendon. This is half muscle, half membrane. तो membrane से ligament आ जाए ये ठीक है, but tendon से ligament आ जाए ये ligament को मंजूर नहीं होगा. It is not semitendinosus. It is semi. Okay. Question number 61. Is true about the biceps. यार आंसर बता दो, आसान क्वेश्चन है। Right, 61, the answer is B. It is attached to the head of the foot. Right, so very easy to exclude options here. It is very easy to options here. That first of all, since biceps femoris, it is a hamstring muscle, right? So it is attached to the tibia or the fibula, and it is true that it is attached to the head of the fibula. First of all, it is very easy to answer simply directly. Is it a muscle of the adductor compartment? Adductor compartment कौन सा होता है? Adductor compartment is the medial compartment. Adductor compartment is the medial compartment. Medial compartment has the adductors. Adductor longus, adductor brevis, adductor magnus, gracilis, and one of your obturators. Okay, ये होते हैं adductor compartment. But not the biceps femoris. Biceps femoris is part of the posterior compartment of the thigh. Adductor femoris is part of the posterior compartment of the thigh. It is not option A. It is not supplied by the femoral nerve. It is supplied. It is having dual nerve supply. Tibial part of sciatic nerve and obturator nerve, right? Tibial part of sciatic nerve. Okay, इसमें भी femoral nerve से nerve supply नहीं है. Not related to the medial ligament. It is on the lateral side. On the lateral side. A not related to the medial. This is about question number 62. Relatively easier question. Right. So the answer for 62A. Inversion and eversion occurs at which joints? The answer is option A, subtalar and mid-tarsal. Right? There is subtalar and mid-tarsal joints. So I've repeatedly told you this, that the subtalar joint, very important, is where the inversion and eversion take. Right? Also, at the subtalar joint, you have abduction and adduction of the foot. The question number 60. Muscle is responsible for plantar flexion. So plantar flexion is brought about by soleus. That's true. The flexion is brought about by soleus gastrocnemius. Right? Whether soleus gastrocnemius, they are two muscles that are present posteriorly. Okay, so plantar flexion is brought about by which of these muscles? The answer is going to be soleus and gastrocnemius, right? So here, let's do one thing. Have a conceptual idea कि अगर ये आपका ये फुट है, ये मसल आ रहा है सोलियस, ये आ रहा है मसल यस, ठीक है। तो उसके बाद when the soleus contracts, it will bring about plantar flexion. And what are the muscles that are coming from front? Tibialis anterior is coming from front. So it brings about the opposite movement. It brings about dorsiflexion. See, it is coming from behind. So when it contracts, it pulls the heel upward. It pulls the upward. So it will bring this curvature. That is for plantar flexion. And when the tibialis contracts, it will bring about this kind of movement, that is dorsiflexion. So remember here, the soleus muscle here is responsible for plantar flexion. Tensor hallucis longus and tibialis anterior, they bring about dorsiflexion, about dorsiflexion, and the peroneus muscle gives you version. Peroneus muscle is longus, especially peroneus longus and brevis. They are responsible for the subtalar, right? Question number 64, lymphatic drainage of clitoris. Lymphatic drainage of clitoris. The lymphatic drainage of the clitoris is to the deep guineal lymph node. So remember that we talked about the glans, right? So the glans penis is homologous to the clitoris. Yes, by itself, the glans penis is homologous to the glans penis and clitoris, both of them, their drainage is to the guineal lymph, right? To the right, got this. Question number 65. The time of birth between following ossification cycle. Yeah, this is another good question because this you guys I know obviously have some confusion about the upper. So I'll just clear that confusion out after that. The question from PGI, so this is multi-answer correct. Okay. Health benefits saying the answer is A and C. The answer is A and C. I will not say that is incorrect, but that is partially correct. There is one more option that you have to choose here. A and C is partially correct. A and C is partially correct. There is one more option that you have to choose. One more option. Out of B, D, and E, one more option. So I'll do it for you. The answer is option A, C, D. The answer is option A. So first you should know that at the time of birth, they're saying lower end of femur and upper end of tibia. So for that, I have kept this diagram. I've kept this diagram. Take lower end of femur and upper end of tibia. Look here, this is the tibia. Tibia, the proximal epiphysis, is present at the time of birth. Right? This is clear for you. The upper end of present at fibula, it develops later. It is not there at birth. You can figure out the lower end of femur. The lower end of femur. Here also in the options, the lower end of femur also present. That is how these two are going to be there. Patella, you have to remember that its ossification starts at 3 to 6 years and it ossifies by puberty. So that is around its ossification by the age of one thing that you remember here. Alright. Then nothing here related to the birth. ADS का नहीं है, olecranon process का नहीं है, ulna का नहीं है. It capitulum, lateral epicondyle, nothing. Head of the humerus, part of the head of the humerus, it develops around from birth to 3 months. So not considered the head of the humerus here or the upper end of the humerus here because it takes some time for it to ossify. It is up to 3 months, right? Again, I will not consider this at birth. These two have answer and calcaneum is on. Next question number 66. Of the following structures pass out of the pelvis through the greater sciatic nerve and lesser sciatic nerve. Want me to show you ossification of here? You can see here for the various bones what is the thing, right? What is the ossification and for the so these bones generally a lot of these they appear by the around the birth or in the initial few months surrounding the birth. That is why these tarsal bones start to ossify before birth. So there are these 7 tarsal bones, okay, and they end their ossification by the 5th year in all tarsal bones. Okay, तो ये है. You can see that the tarsal bones they start to ossify birth, and at various points of time up till 5 years they will complete their ossification. So they have appeared ossification does have appeared for all the tarsal bones. Okay, and by the 5th year all of them will the last to ossify here. You can probably make out here that intermediate cuneiform it takes around 4 years. The navicular takes around 4 years. So, but otherwise, all of these they have their ossification developing. Just give me I drank too much. Meanwhile, attempt question number 66. I'll be back. Please attempt question number in the minute I am back. Okay, so was answer the question. Karan Sani has answered the question. Number six. Which of the following structures passes out of the greater sciatic nerve and enters through the lesser sciatic? So what are the structures that pass through the greater sciatic nerve? Remember that these that pass through the greater sciatic nerve, and out of these, some re-enter through the lesser sciatic nerve. Right? Pin. Right? These are the structures, and this will also tell you which are the ones that enter through the. Right? The internal pudendal artery, one of these structures, artery, exits through the greater sciatic nerve. But the internal pudendal artery has to supply structures in the perineum itself. The internal pudendal artery then curves around and goes back through the. Similarly, the pudendal nerve. Similarly, the pudendal nerve. Pudendal nerve and the internal pudendal artery are two structures that will sit through the greater sciatic notch, and then they will re-enter through the lesser sciatic notch. Right. So, what are these spin structure? Do you want to know? Listen to this very carefully. Very useful. First of all, there are some structures that first pass through the key muscle, the key muscle here or this region around the notches, around the sciatic notch. Right. Okay. So look very carefully. This is the best mnemonic that you will see for this. You're not able to access my arteries of the upper limb class. So what you have to do is you have to download the Unacademy learning app. You've probably not downloaded the app, so that is why you are not able to access it. Please download the Unacademy app from the Play, right? So this is the key muscle here is the piriformis, like I told you. Why is it called the key? Because there are a few structures that pass above it, and there are a few structures that pass below it. Maximum structures will pass below it. There is only one structure passes above the piriformis. Still divides the region very importantly. That is why it is the above the piriformis. You will have only one. Here is the superior gluteal artery. Basically, two structures: the gluteal artery and the gluteal nerve. That is what you have to remember here. The gluteal artery, the gluteal. Now, second structure below the piriformis, have seven structures. Below the piriformis, you have seven structures. Pins, pin. What is this pin here? These are the structures that will re-enter via lesser sciatic foramen. These ones they will go to the lower limb. Once they will go to the right. Now what are these? I already told you here you have the pudendal nerve. Have the pudendal nerve. Will have the internal pudendal vessels. Have the internal pudendal artery and vein. Right. So internal pudendal vessel. Right. What is one thing that is left is the nerve to obturator internal. Obturator. So these are all the structures that will re-enter. These are the structures that will enter. And what are the structures that will go straight to the lower limb? They will never look back. Those are, for S you have sciatic nerve, the largest nerve of the body. Sciatic nerve. P is for posterior cutaneous nerve of the thigh. P, posterior cutaneous nerve of the thigh. So here upper you had the, above the piriformis you had the superior gluteal artery. Here you have the inferior gluteal artery and nerve. Here, gluteal artery. Now what is left is the nerve to quadratus. Nerve to quadratus. Okay. And plus here you will also see that you also have the nerve to obturator internus and you also have the tendon of op. But this only does not re-enter per se. It only passes through lesser sciatic foramen. Sciatic foramen. एक और structure pass करता है. If you write the structures passing through the lesser sciatic, you will also write tendon of obturator. Right? Tendon of obturator. And these two structures they will pass through the Alcock's pudendal canal. Alcock's. Hope this slide is clear to you. Very important slide. Okay, इसका अभी के अभी screenshot ले लो. Important slide. Okay, Gupta, I hope you have downloaded the Unacademy learning app. Okay, like I told you, सारी free classes access करने के लिए Unacademy learning app तो download कर ही. Otherwise mobile पे access नहीं कर पाओगे, web पे access कर. Okay, so these four structures they are going to not re-enter via the lesser sciatic foramen. Are the okay, so this much is clear for you. This much is clear for you all. And these upper structures, they are the structures passing through the sciatic foramen. Yeah. That is the summary slide, and this is the best mnemonic here that you should know here for all of this. Here is intended. Let's move on to question number 67. Nerve supply of the popliteus muscle. Right by which nerve? Popliteus muscle, it is right by which nerve? जिम करना है उनको। खैर मैं बाद में कुछ चले यार। Popliteus muscle is supplied by which nerve? Answer is tibial nerve. Absolutely. So tibial nerve, as you know, it passes through fossa. It passes through the central portion of the popliteal, right? Tibial nerve passes through the central portion of the popliteal fossa. So that's absolutely the correct answer, right? Question number 66. So the following is true about the gluteus maximus. True about the gluteus maximus except number 68. Sorry again for all guys. Something urgent. It's a messed up day. I hope you. ठीक है, ये वाला क्वेश्चन समझ आया ना? पॉप्लिटियल फोसा के सेंट्रल पोर्शन से पास करती है टिबियल नर्व। तो पॉप्लिटियस मसल इट इज सप्लाइड बाय। क्वेश्चन नंबर 68। ट्रू अबाउट द ग्लूटियस मैक्सिमस। ट्रू अबाउट द ग्लूटियस मैक्सिमस एक्सेप्ट one of these statements is not true about the gluteus maximus, and ये statement I've stressed repeatedly. Think about what is the nerve that will supply the gluteus maximus, or the nerve that will supply the gluteus maximus. Supplied by the superior gluteal nerve, it is incorrect. Why? Because gluteus maximus is such a big muscle. It says that I need a whole nerve to myself. That nerve will only supply me. What is that nerve? Inferior gluteal nerve, right? Inferior gluteal nerve. Inferior gluteal nerve, it supplies three muscles, and those are gluteus medius, minimus, and tensor fascia, right? These are the muscles that will be right? Inferior gluteal. The gluteus maximus has its own nerve, and that nerve exclusively supplies a single muscle, the gluteus nerve here. Nerve maximus wants an entire nerve to itself, and that nerve separate, that is the inferior gluteal nerve. Please, question number 69. Okay, क्या भाई सारे, nice name. I assume that you are answering from the previous question as A because question had the answer as 9. She's saying tibialis posterior. That's absolutely correct. Tibialis anterior, hallucis longus, and flexor. All of these are inverters. Will insert on which will insert on talus to have their insert. Whereas tibialis posterior, it inserts on almost all the tarsal bone. Here, tibialis posterior. So the talus is present in the artery. It is somewhere around where talus would be. So tibialis posterior, it is coming from behind, and the chance that the tibialis insert the, the talus bone. Talus posterior coming posteriorly, it does not insert talus bone, does insert the tibialis posterior. Tibialis posterior is a tibialis posterior is an the insertion is mainly the navicular. It performs two functions. Posterior muscle, so it will perform plantar flexion and perform. Question number 70. Number 70. Deltoid ligament is composed of all of the following of the very simple, guys. In very simple. Think of this in this way that the deltoid ligament, if it is written here, it must be a ligament of the foot because if you can relate with the other options, right? So Mistius related it correctly. The answer is C, tibiofibular. You can see here that tibio, it is a ligament that is present inside the foot. So tibia and calcaneum, again this is a talus bone. Tibia and talar, so this is again a talus bone, tarsal bone, again a tarsal bone. Clavicle is also a tarsal. These are all so deltoid ligament. It is composed of these three ligaments, right? And these ligaments are between the tibia and another tarsal bone. Whereas the tibiofibular ligament, it is not part of the deltoid ligament. Question number 71. Question number 71. Good question. And it mentions two reflexes here. One of the reflexes that I also want to talk to you about. I will be discussing two reflexes here that are good for you to know. One of those reflexes is also used to test the integrity of the spinal nerve or the integrity of the spinal pathway, and it is used to get an analysis of how severe a spinal shock injury, and it is also used to analyze the recovery of a spinal shock. of it, where is the sartorius muscle located? What will happen if you pinch or you touch the skin around over the sartorius, or you pinch the sartorius? What reflex should be? If you have heard about this reflex, you know about this reflex, think that sartorius muscle is located on the medial side of the leg. Sartorius muscle passes from the medial side of the leg. Right? Think about stroking the skin over the sartorius. What reflex will be, right? So Mishti has answered correctly that the reflex it would be the cremasteric reflex. The reflex is the cremasteric reflex. I will tell you what is the cremasteric bulbocap. Right? So look here, this is the cremasteric reflex. Sartorius muscle passes something like right. That's the Taylor's muscle or sartorius muscle. So stroking the skin over the sartorius, right? When you do that, that what it does is it leads to the contraction of this, right? Pulls the testes upwards of the ipsilateral side. Lateral elevation of testes. That is the cremasteric, the medial side of the thigh. Okay? Another important reflex. Now, one reflex that you should know here is bulbocavernous. So, very funny reflex. I really find it funny. What happens here is that on applying pressure to the glans or to the, like I told you, that glans and clitoris are pretty much homologous. If you apply pressure on the clitoris or if you apply pressure on the glans, what happens is to the spinal pathway there is a what happens is there is contraction or constriction that can be measured. The bulbocap. Find this reflex to be really weaker on the clitoris or glans. Action of number 72. Action of gluteus medius. You can see out in the video. Might not be able to make out the word medius. So question says when foot is off the ground, the action of gluteus medius is. So this is the basis of the Trendelenburg principle. Anybody, the action of gluteus medius. This is the principle of the Trendelenburg. And the foot is off the ground. The action of the gluteus medius is to keep the horizontal level, to keep the center of mass uh, same plane. So it makes the opposite hip horizontal. The when one of the foot is off the ground. Otherwise, that is why the gluteus medius is damaged. Why when the gluteus medius is damaged, what happens is that when you lift off the one foot, the other hip falls. The other hip also. I have to just show you the action of yes. You can see here the action of the gluteus. What happens when this foot is off the ground? When this foot is off the ground, so then the gluteus medius will try to normalize it. It will try to normalize it. It is off the ground. This pelvis was going upward, it was going downwards. The gluteus medius keeps it at a normal level. But if you have the Trendelenburg sign, when this foot goes like this, when the foot is lifted, it will fall. It will fall. Right? That is what it has to gain. That is what it has to makes the operating walk. 73rd, lateral popliteal nerve injury can cause. What does lateral popliteal nerve think? What is lateral popliteal nerve? Able to know is lateral popliteal nerve. Okay, yeah, bhai sahe. Anybody, if you has the answer to this question, what is the lateral popliteal? What is another name for lateral popliteal? Once I tell you the other name for lateral popliteal nerve, this question is very simple. Most difficult part of this. Yeah, the lateral popliteal nerve is another name for common peroneal nerve. Another name for common peroneal. Now, can you guess? Lateral popliteal nerve is another name for common peroneal. Common peroneal nerve has two branches, deep peroneal nerve and superficial. Now, can you tell me at least what the answer is? Deep peroneal nerve damage causes, it causes what? Foot drop. It causes foot drop. Drop means plantar flexion. Foot drop means plantar flexion of a plantar flexion means that the person will walk on his heels or he will walk on his toes. He will walk on his toes. Person will walk on his toes like a horse. What is the name for horse? Horse is bus. Horse is bus. So the person does not walk in his heels. Heel is calcaneum. Heel is calcaneum. So it is not calcano, it is pino. Why? Because the person walks like a horse in plantar flex toes. And what is varus? Varus and valgus. Valgus means wide open and varus means closed. Alright. What happens? Since the damage is not to the deep peroneal nerve, damage is to the common peroneal nerve. So eversion will also be lost. What is lost is eversion. There is loss of eversion. To loss of eversion, there is inversion, right? And inversion means that the angle between the two foot, this is, so it is equinovarus. Talipus equinovarus means it is also called as club foot, another name for club foot, right? Look at this. There is plantar flexion. There is plantar flexion, so the person is walking on heels. Because of he is walking on heels, it is equino, right? And since there is inversion, there is inversion. Inversion, for inversion, the word that they have used is varus, because both foots were inverted, they will be close to each other. If they were inverted, they will be away from each other. That would be valgus, this would be varus, right? So equinovarus, talipus equinovarus. I hope I've been able to explain to you the how to remember what is equinovarus, what is calcaneovalgus, what is calcaneovarus, what is equinovalgus. Alright, ये सब समझ आ जाना चाहिए based on the words equino and calcaneovarus and valgus. Yeah, ये combination है varus valgus, valgus varus. Yeah. Question number 74. Which of the following about the medial meniscus is true? I've already stressed on the differences between the lateral and the medial meniscus. Hope you are able to answer. Be answering question number 74. Anybody who knows the answer for question number 74, I had differentiated between the medial and the lateral. यार मैं बता ही देता हूँ फिर। medial meniscus, lateral meniscus. Medial meniscus is, first of all, it is M for medial, M for more liable. L for lateral, for less liable. Okay. Then second thing that I have told you, that the medial meniscus, it is attached to the tibial collateral ligament. As to, because it is on the medial side, it attached to the tibial collateral ligament. Tibial collateral. It is not attached to the fibular. Okay, that is one point. And M for L for lateral, so this is lunar or circular. Or this lunar means circular. L for lunar means circular. Alright. So this is circular and this is semi-lunar. Semi-lunar. Right? So B, C, D are wrong. You can make out this is more liable, so this is correct. In question number 75, the forward displacement of the tibia is prevented by forward displacement. Remember one thing, if this is the tibia, the femur. Forward displacement of tibia is same as posterior displacement of. Guys, what is the answer to 75? Answers? Right. So remember that forward displacement of tibia, it is prevented by forward displacement. It means anterior displacement of tibia. It is prevented by anterior cruciate ligament. Posterior displacement of tibia, it is prevented by posterior cruciate ligament. Similarly, posterior displacement of femur, it is also prevented by anterior cruciate ligament, because it is one and the same thing. And posterior cruciate ligament prevents the anterior displacement of the femur. Right? Posterior displacement of femur and anterior displacement of tibia prevented by anterior cruciate ligament. And posterior cruciate ligament prevents the anterior displacement of femur or the posterior displacement of. Right? Question number 76. Spring ligament is also called as. Spring ligament is another name for spring ligament. Right. So since nobody is asking, I'll just tell you the answer. Spring ligament is also called as the calcaneonavicular ligament. Another calcaneonavicular ligament. Nobody actually answering, or I'm not able to see them. You can see there are some people live. Somebody can hear me, please write a yes or a no, because I feel like I'm talking to myself now. If you're watching a previous part of the video, that whenever you come to this part, just question number 77. Major arterial supply to the anterior cruciate ligament. Major arterial supply to the anterior cruciate ligament. Right. So Donna has written a yes. Thank you so much. Like सही में कोई देख रहा है. The major arterial supply to the anterior cruciate ligament. Right. So the major arterial supply to the anterior cruciate ligament, it comes from the middle genicular artery. Comes from the middle genicular artery. So I don't know the diagram. Anyways, the anterior cruciate ligament, it is present mainly in the middle part. Right. It is attached to the medial side of the lateral epicondyle. So it receives supply from the middle genicular. Question number 78. Which one of the following arteries pierces the oblique ligament? Right. Relatively a little more important question. Yeah. All right. Right. So Mishti has said the answer is medial genicular artery, same as the previous, right? So now you know two things about the medial genicular artery that you know about the medial genicular artery. So ऐसे ही पढ़नी होती है anatomy. Keep summarizing what you know about the structure. Medial genicular artery, you know it pierces oblique popliteal ligament. Now you know it pierces the oblique popliteal ligament. What else you know? It lies the anterior cruciate ligament. What do you know about the oblique popliteal ligament? That it is coming from the tendon of the semimembranous. What do you know about the semimembranous? That semimembranous hamstring. Now, what do you know about the hamstring? There are four criteria to define a hamstring. Once you have this flow, that is how you will be able to connect everything in anatomy, right? You should be able to quickly correlate things with everything that is related to it. That is to study. Question number 79. Cremaster muscle is innervated by which of the following nerve? Now think very carefully why they will ask you the innervation of cremaster muscles. They will ask you that because cremaster muscle is part of the cremaster. Okay, so every question has some significance. You just have to know what that significance. Have to know what that significance. Right? So answer is going to be genital branch of the genitofemoral nerve. Answer is going to be genital branch of the genital nerve. See, there is a femoral branch of the genitofemoral nerve, and there is a genital branch of the genital, right? So the femoral branch and the genital branch. There are two branches here, right? And these branches they are part of the cremastic reflex. Genital branch of the genitofemoral. Question number 80. All of the following all of the following statements concerning the sartorius muscle are correct except which of the following is not correct regarding the sartorius? Okay, right. It extends the hip. This is wrong. You all know that sartorius, a muscle that will flex the hip. Flex the hip. Sartorius is the honeymoon muscle. Sartorius is the honeymoon muscle. For the honeymoon, what do you have to do? You have to flex the hip, right? Honeymoon muscle is how I remember. Taylor's muscle, longest muscle in the body, acts across two joints because it acts on the hip also and it acts on the knee also. Right? So that is about the sartorius. Pratap Bush has also given the same answer. And Pratap Bush. Which of the following nerve is not a branch of the lumbar? A branch of the. Right. So Donna is right in giving this answer because sciatic nerve. I've already pointed out that the sciatic nerve, it is a branch of the sacral plexus, not a branch of the lumbar plexus. Remember, there was a question: which of the following is the largest branch of the lumbar plexus? The answer there was femoral nerve. The answer there was femoral nerve. Although sciatic nerve is the largest nerve of the body, right? Sciatic nerve is the largest nerve of the body, but the answer that we had given for the largest nerve of the lumbar plexus was femoral nerve because the sciatic nerve is a branch of the sacral. Okay, femoral nerve is a branch of the. Question number 82. Femoral ring is bounded by the following structures except. I've already told you what the femoral ring is going to be. The answer is option C, femoral artery. Right, right again. Absolutely right. So since nobody else is answering, I'll just explain this. See, this is another diagram that I've kept here. The femoral vein. It will form the lateral border. From the lateral border. Right? And here you have the lacunar ligament. You have the lacunar ligament. It will form the medial border. Anteriorly, you have the guinal ligament that will form the anterior border. And posteriorly here, this is the frontal part. So this is the inguinal ligament. You have anteriorly and posteriorly will have the actinius muscle forming the floor of the femoral triangle. Okay, so the femoral artery has no significance, right? Question number 83. The version of the foot is produced by. वैसे इसका एक डायग्राम पहले भी था. Okay, remember this diagram. This is a very good diagram. So the femoral artery, and as you can see here, it does not form any boundary of the canal. उसका femoral canal का ऊपर वाला part femoral ring. Let's come back here. Question number 83. The version of the foot is by. So the following produces eversion of the foot, right? So there are two muscles for eversion and there are two main muscles for inversion. I hope you remember that inversion and eversion occurs at the subtalar joint. Joint at which inversion and eversion occur is the subtalar joint. Right. So Donna is nurses, but that answer is a wrong answer. Right answer here is peroneus longus. The right answer here is peroneus. So remember there are two muscles which are everters, peroneus longus and tibialis anterior and tibialis posterior. These are right. Number 84. Now you've got a question that is from the based on the previous question. Just like what I just told you. So just take 2 seconds to answer this. Take less than 2 seconds to answer this. Quick answer for this. I need a very quick answer for this. I have just told you this in the previous question. What are the everters? Right. So Donna is carefully listening. The answer is tibialis posterior and tibia. These are muscles. Question number 85. Bound posterior cruciate ligament. What about the posterior cruciate? What is the cruciate? Right. About the posterior cruciate ligament, one of the true statements is that it is attached to the lateral femoral condyle. It is attached to the lateral femoral condyle. This is the true statement according to you. No. This is correct. I've just told you about the dislocations. I've just told you about the dislocations. Just think on those lines. Posterior cruciate ligament is not attached to the lateral, not in also. Take another answer, Donna. As another answer, you taking a guess? You taking a guess, Donna? First answer was wrong. Do you have another answer? Not. About the posterior cruciate ligament, what is the true statement? Get this image. The posterior cruciate ligament, anterior cruciate. The anterior cruciate ligament, what it does is it prevents the anterior displacement of the, whereas the posterior cruciate ligament, it prevents the posterior displacement of the, right? Cruciate, it is named according to the attachment of the ligament on the tibia, right? So its attachment is according to where it is attached on the tibia. And the posterior cruciate ligament, posterior displacement of tibia, posterior cruciate ligament, and displacement of tibia. That is what it prevents, right? That is what it prevents. And if there is a fracture, or sorry, if there is a tear of the anterior cruciate ligament, there will be anterior displacement because that is no more prevented. Similarly, posterior displacement can also be displacement of, and here displacement of tibia can also be written here displacement. This question prevents posterior dislocation of tibia. It's true for the posterior. You don't have to think anymore. So now you know that it is not relaxed in flexion, it is relaxed in full tension. Relaxed in full tension. It is not intrasynovial. Right, the synovial. Okay. Right, that is about these. Question number 86. Adductor canal, it lies beneath what muscle? Adductor canal. If you know another name for adductor canal, you will know the answer to this. Adductor canal lies beneath. The canal lies deep to right. So Misty, do you have an answer, or Misty, you're not watching any? Adductor canal lies beneath the sartorius. Alright. So why not vastus medialis? Isn't vastus medialis one of the boundaries of the adductor canal? Vastus medialis. What is the floor of the adductor canal? Forms the floor of the adductor canal. You know the boundaries of the adductor canal. Don't worry. Right. 86. The adductor magnus according to Misty. Now, the answer that was given previously, correct? The answer is artery. Have a look at this. That is somewhat how the adductor. This muscle here, adductor longer. Really, you will have the as point. Okay? This medial. Sartorius. Where you will have a sartorius is present super. Just when you go deep to the sartorius, you will find the duct. That is why this is also known as the subsartorial. Why this is also known as the subsartorial. Right? The adrenal is also the subsartorial. It is lying deep to the. Question number 86 हो गया. Question number 87. Alright. Posterior dislocation of the femur on the tibia is prevented. Is not posterior dislocation of femur. लिखा है कि posterior dislocation of tibia लिखा है. ये मैं question गलत कर रहा हूँ. Okay. Very careful of what bone is written. Dislocation. But is different. Posterior dislocation is different. Posterior dislocation of tibia on femur or femur on tibia. 7. What is your answer, guys? Again, Misty and Donna have made a mistake. They have not read the question here. Simply answered posterior dislocation. Uh, Donna has made a mistake. Here, look. Here, cushion. Posterior dislocation of the tibia. Posterior dislocation. Tibia is posterior dislocation of या इज प्रिवेंटेड बाय, मैंने अभी स्पेसिफिकली बोला कि ध्यान से पढ़ लो, फर्स्ट सेम गलती, प्रिवेंटेड बाय पोस्टीरियर क्रूशिएट, बट anterior dislocation of tibia is same as posterior dislocation of, के हिसाब से आंसर आएगा एंटीरियर क्रूशिएट। देखो सिंपल सी बात, अगर टिबिया anteriorly displaced हो रहा है, if the tibia is getting displaced and they are with respect to each other, right? Anterior and posterior displaced. The femur, let's say the tibia, let's forget about, right? If this is, let's say this is the tibia is moving anteriorly, means that the femur is automatically displaced posteriorly. Or if the femur is getting displaced posteriorly, that means that it is an anterior displacement of the tibia, right? And that is, so therefore anterior displacement of the same as here dislocation on anterior displacement of, yeah, by here cushion. So posterior dislocation of tibia is also prevented by the same ligament. Yeah, ये question number 88. Forceful inversion of the foot. Forceful inversion of the foot, fracture of the tuberosity of the which type? Very easy. I have told you the attachment of peroneus muscles of the various peronei. The inversion is going to be limited by the inverters, and eversion is going to be limited by inverters. Okay. Right. So answer given by Mishti is wrong. Peroneus longus is not the answer. The peroneus longus, it inserts on the base of the first metatarsal. It is long. Why? Because it inserts on the base of the first metatarsal, not on the base of the fifth metatarsal. Right? Peroneus brevis is short. Why? Because it inserts on the base of the, right. I had shown you these insertions in the previous lecture also. If this is the foot, right, the peronei, they come from here. The peroneus brevis, it inserts here, so it is short. Peroneus longus is long, so it crosses here and it inserts at the base of the foot. The base of the fifth metatarsal is the insertion of peroneus brevis. Forceful inversion, when there is too much inversion. So peroneus longus and peroneus brevis are the muscles for eversion, right? They are the muscles for eversion, right? तो जब ज्यादा इन्वर्ट करोगे तो ये बहुत ज्यादा स्ट्रेच हो जाएंगे, दे विल बी स्ट्रेच टू मच एंड देयर विल बी टू मच पैसिव टेंशन. So if too much passive tension is there in peroneus brevis, it might happen that the tuberosity of the fifth metatarsal gets fractured. Gets fractured. Alright? Cause of too much pull by the peroneus brevis. By the peroneus brevis. Because it is an everter. So जब उल्टा action होगा, it is the antagonistic muscle. So it will have a lot of passive tension. Question number 89. Very common question. Inversion and eversion movements occur at which joint? Give me the answer in like 5 seconds. Inversion and eversion is occurring at which joint? Question number 89. The answer is very good, Mishti. Very good. Subtalar joint. Very quick answer. Subtalar joint from question number 90. Anterior cruciate ligament prevents. Now, please answer this question correctly. It is a multi-answer correct. Very good, Sukanya R. 90. Anterior cruciate ligament prevents anterior dislocation of tibia and posterior dislocation of femur. That's true. Okay, like I told you that with respect to tibia, anterior cruciate ligament tibia को anterior नहीं जाने देगा. So it prevents anterior dislocation of tibia and it prevents posterior dislocation. Right? You can relate that also because the anterior cruciate ligament is attached anteriorly on the tibia. Right? It is attached anteriorly. तो अगर आगे लगा है तो वो उसे और आगे खींचने नहीं देगा और फीमर को और पीछे जाने नहीं देगा. ठीक है, समझ रहे हो ऐसा क्यों है? There's this X shaped arrangement. So, what exactly? Kind of. मेरा anterior cruciate ligament या posterior cruciate. तो ये क्या करेगा? ये आगे नहीं जाने देगा टिबिया. Will prevent anterior dislocation of right, and this will posterior cruciate ligament will prevent posterior dislocation. Just to understand this, I will draw a very thunderous schematic diagram, not at all anatomically correct, but it will help you understand. Remember, the anterior cruciate ligament inserts anteriorly the surface of anterior surface of the tibia, right? The posterior cruciate ligament it inserts on the posterior part of it, right? Now, if I displace the tibia anteriorly, if I displace it anteriorly, right? Placing the tibia anteriorly. Now, what will happen? This will help you remember. Now, you won't forget for your entire life to displace the tibia anteriorly. Anteriorly displace करा tibia को, तो ये stretch हो जाएगा. This will get stretched. This won't let it go, right? Will prevent the anterior dislocation of tibia. And if I try to move this posteriorly, again this will prevent the posterior dislocation of the femur. Alright? Now what about this? What about the other one? Look here. It will prevent, if I try to move the tibia posteriorly, posterior cruciate ligament will get stretched here. So it will prevent posterior dislocation of the tibia. And if I try to move this anteriorly, it will prevent the anterior dislocation of the femur. ये अच्छा लगा क्या जो मैंने डायग्राम सा बनाया है स्कीमेटिक से याद रहेगा क्या? Please tell me that you will be able to remember with the help of this. Please tell me you will be able to remember with the help of schematic. I tried to simplify it, very simplified too much for you. In fact, simplify नहीं करता कोई. Still try to understand this. Don't make a mistake here. Okay. Question number 91. A young patient presents with the loss of sensation in the sole of the foot with paralysis of the medial side of the plantar muscles of the foot. Most likely nerve involvement. Question 91. Most likely nerve. Thank you, Sukanya. Thank you, Ayush Shukla. Guys, for those of you who were not there in the start of the lecture, my plus referral code is Chetanya10. And if you use my code, you get a 10% off on all courses. Whether it be for NEET PG, UPSC, NEET UG, जो भी course लेना है ले लो. Okay. And मेरा referral code use करोगे, so I will tell you how to use credits and I will give you some cashback from my end. And जो भी deal मेरे से मिलेगी, I promise you that will be the best deal. Alright? And most likely nerve involvement बतानी है यहाँ पे. And if you want to contact me regarding the cashback, you can contact me on Instagram @chetanya.blue. Please write that you want a plus subscription in your message. And if you contact me on Telegram, then my Telegram channel is @NEET PG. You can contact me from this discussion group. का discussion group है एक, उसको join कर लेना, वहाँ से मैं तो अपनी Telegram ID छोड़ दो comments में, मैं खुद contact कर लूँ. Tell my Unacademy person contact you. Option is D, tibial nerve. Option is okay, because the tibial nerve it divides into the medial and lateral plantar nerve. Tibial nerve. No, no. Kana, the answer is not C. The answer is D. Tibial nerve divides into the medial plantar nerve and the lateral plantar, right? So medial plantar nerve and lateral plantar lies the muscle in of the. Okay. The answer is option D. Now tell me one thing. Tell me one thing. Do you know which are the muscles which are supplied by muscles supplied by medial plantar nerve and lateral plantar? Okay. Start of the video, I told you a trick to remember this. Start of this video, I told you a trick to remember, right? What was that? Abductor hallucis brevis, abductor minima brevis. में क्या लिखना था? Flexor digitorum brevis. हाँ, इधर क्या लिखना था? Flexor hallucis brevis. इधर क्या लिखना था? Flexor digiti minima. में क्या लिखवाना था? Adductor hallucis. क्या था? Adductor. ये हो गई फर्स्ट लेयर, ये हो गई थर्ड लेयर. सेकंड और फोर्थ लेयर लिख देनी थी उसके बाद जल्दी से. लेयर और फोर्थ लेयर. सेकंड में क्या था? फर्स्ट से लेके सेकंड, थर्ड, फोर्थ लंबराइकल भी. Besides that, there was flexor digitorum max. Here you had interossei. Had now you know that that is how you write all the muscles. How you will write all the muscles. And once you have done that, your job is very easy. All you have to do is take this color and you have to make this L like this, another L like this. Obviously medial side है तो medial plantar nerve will supply it medial, and along with that it will also supply medial and a half. Four muscles, best muscles by the lateral plantar. Okay. Question number 91 is done. Question number 92. All of the following muscles are composite muscles. Hope you know what are composite muscles. They are hybrid muscles. They are hybrid. I've shown you a table, remember, for composite muscles. So one of these is not a composite muscle. जल्दी से बता दो कौन सा composite muscle नहीं है. It should be a fairly simple answer. It is a fairly option B, rectus femoris. That's true. Rectus femoris is not a composite muscle. Rest all of these are composite or hybrid muscles, right? Question number 93. Just passing under the extensor retinaculum. Right. Kanya is right. Ayush were wrong. The answer is what is the answer for 93? Now tell me the answer for question number 93. 92 was very easy. A is correct, but also C is correct. So answer is going to be D, both A and C. Tensor digitorum brevis doesn't pass, and superficial peroneal nerve, both of these, they don't pass under the extensor retinaculum. Only extensor hallucis longus from here passes. These are the muscles, these are the structures that passes. Tibialis anterior, extensor hallucis longus, okay, anterior tibial vessels, anterior tibial nerve, extensor digitorum longus, and peroneus tertius. Alright, so how people remember this is Tom has very nice dog and pigeon, and duck and pigeon. Okay, dog रखते हैं यहाँ क्या written duck. Much easier to remember that there are two birds that Tom has. Tom loves birds. Very nice birds, duck and a pigeon. H and right? Tom has Gallus anterior, extensor hallucis longus, anterior tibial vessels, anterior tibial nerve, extensor digitorum longus, peroneus tertius. Question number 94. Which of the following move causes pain in the deep posterior compartment? Right? Let's stop the class at 95 questions because it is getting too long otherwise. And we'll do the rest 5 questions part tomorrow, and we'll do the remaining 3 questions of tomorrow. Tomorrow we'll be doing 55 questions. Right? Try to be much more rapid tomorrow. Right? So the answer is not plantar flexion. The answer is going to be dorsiflexion. Right? So if you dorsiflex the foot, try to dorsiflex the foot, will pull. It will create a pull in the posterior compartment muscles. Okay? अगर तुम dorsiflex करोगे, this movement, right? There will be a lot of tension here. There will be a lot of tension here. Right? A lot of passive tension here. And that passive tension will not cause pain. So, right? So dorsiflexion of foot, the answer here. Dorsiflexion of foot will cause extension of the tendons which are there in the posterior compartment, and this passive tension will cause pain in the question number 95. Last question for today. Or all right, we can complete 100 questions. Okay, let's complete the 100 questions. Question number 95. Your femoral ligament arises. Where does the so what is posterior compartment syndrome? There are a lot of compartment syndromes. What happens there is compression of blood vessels. What is compartment syndrome? Please read that. What happens is there is an increased pressure in one of the body's vessels, and that pressure compresses the nerves around it. Right? There is insufficient blood supply, and because of that, the compartment syndrome is very painful. There is an increased pressure, this severely increased pressure, and that increased pressure that constricts the blood supply also, and because of that, there is necrosis also. So it's a very severe condition. Requires emergency cutting of whatever tissue at the back. Right? So iliofemoral ligament, also called as the ligament of Bigelow, arises from the anterior inferior iliac spine. Please remember, it is the strongest ligament of your body. Arises from the anterior inferior iliac, right? AII. Question number 96. This I have already stressed you so many times that you'll be able to answer this very quickly. Very, very quickly. Your gluteal nerve supplies all of the following muscles. This maximus requires its own nerve, and that nerve is your gluteal. That nerve is the your. Question number 97. Anterior wall of the inguinal canal is formed by the muscle. Right, absolutely true. External and internal oblique muscles. External and internal muscles for question number 97. Anterior wall is formed by, right, external and internal. Question number 98. All statements concerning the conjoint tendon are true. Right. So here conjoint tendon is first, the incorrect statement is it is not it is continuous with the inguinal ligament. Right? Because it is not continuous with the inguinal, not continuous with the inguinal ligament. Question number 99. In injury to the head of the fibula, all are involved except. In injury to the head of the fibula, all are involved except. No, no, not superficial peroneal nerve. Common, no, superficial peroneal nerve is not the correct word when there is the head of it, right? So remember, common peroneal nerve is also called as common fibular nerve, also known as superfibular. The injury to the head of the answer is going to be not A, its answer is going to be tibial nerve. Correct answer, tibial nerve. Tibial nerve is not involved in the injury to the head of the foot. Right? Question number 100, last question. Deep peroneal nerve supplies what part? So here I will also tell you what is the exact nerve supply of the foot. First answer question number 100. Right. Answer is going to be first web space of deep peroneal nerve supplies the first web space of the. So now since you know that, look here. At this diagram. This will show you what is the nerve supply. What is the nerve supply of the foot? So I told you that the medial plantar nerve, it supplies 3.5 fingers. Guys, 3.5 fingers on the skin here, and it supplies 1.5. The lateral plantar. Right? That much is clear. There is some part on the lateral side that is supplied by the sural nerve, and there is some part on the medial side that is supplied by the saphenous nerve, which accompanies the great saphenous nerve. Right? And posteriorly, there is some small part that is supplied by the tibial nerve, which gives the medial calcaneal. So just remember what is the nerve supply of the dorsum of the foot. This is very important. This much is very, very important. Besides this, what is not mentioned here is which are the spaces, how are the spaces supplied. So you can see here the sural nerve, and sural nerve supplies this lateral part, very important, the sural nerve, and the saphenous nerve supplies this medial part. Anteriorly, you have the superficial peroneal nerve, which supplies most of this portion, and the first web space is supplied separately by the deep peroneal nerve. This is very important. First web space supplied by the deep peroneal nerve. Rest here you have the medial plantar nerves and the lateral plantar nerves, and the rest of these web spaces they are supplied by the superficial peroneal nerve. So remember, the first web space is supplied by the deep peroneal nerve. Rest of the web space they are supplied by the superficial peroneal nerve. You can see here all of these are colored in. Okay, that is about the innervation of the foot, sensory innervation of the foot. Very important slide. This is as well, and this is a very good diagram to explain everything to you. Thank you so much for watching this video. Subscribe to Let's Crack NEET, the YouTube channel of Unacademy, and please drop a good comment if you can, and please hit the like button. That's the if you like the video, that's the least you can do for me. And hit the bell icon for notifications so that you know when I'm coming live. Tomorrow at 4 p.m. we will finish the last leg of lower limb MCQ marathon. We'll do the last 50 questions. And this is my referral code plus referral code. I've already told you that you will be able to get a cashback from my end if you use my referral code. And how you can contact me is on Instagram. You can contact me at the rate chetanya.blue. And for Telegram, you can contact me on my discussion group that is at the rate. Right? This is the Telegram channel. It has an associate discussion group from there. Please write that you want.